Welcome, welcome, welcome. Let's continue our review. A specimen for a bilirubin test should be protected from light because light may cause the substances that are to be tested to deteriorate. Did you know that? For example, bilirubin levels may decrease by half within an hour if exposed to light. Other blood tests that require that specimens be protected from light include vitamin A, vitamin B6, beta-carotene, and porphyrins, porphyrins. Capillary tubes that block light are available to protect specimens. Collection tubes may also be immediately wrapped in aluminum foil or placed in a special canister that blocks light. Something to know. If a physician has ordered 4 different blood tests for a patient, the first thing that the phlebotomist should consider is the order of draw, because this helps to determine which evacuated tubes and other equipment is needed and ensures that the proper order is followed. The needle size should be determined after the patient is examined and the phlebotomist is able to assess the patient's veins. The blood collection tray should contain needles in different sizes as well as winged infusion sets, butterflies. The aorta is the primary artery in the blood, carrying oxygenated blood directly from the left ventricle to other vessels and part of the body. The aorta extends from the heart to the lower abdomen and is described according to its location. So the ascending aorta leaves the heart and curves into the aortic arch. The thoracic aorta descends through the chest and the abdominal aorta through the abdomen. At the distal abdomen, the aorta branches into the bilateral iliac arteries. Just some information for you. Raising the arm is not part of the procedure used to help visualize superficial veins. Did you know that? The arm may be lowered as this helps to fill the veins. Other methods include applying warm, moist compress to the site for 5 minutes prior to vein puncture. Use care not to burn the patient. Lightly massage the vein from distal to proximal, wrist towards elbow, and lightly tapping the vein with an index or middle finger. If the needle hits the median nerve during an antecubital venipuncture, the most common patient complaint is severe shock-like pain. If this occurs, the initial response should be to immediately remove the needle and apply pressure, because continuing with the venipuncture may result in permanent damage to the nerve. Usually the pain resolves within a few hours, but if the nerve is damaged, the patient may develop permanent pain and weakness, including complex regional pain syndrome. When collecting a blood specimen from a 2-month-old infant, the primary interaction will be between the phlebotomist and the parent, who may need reassurance. The phlebotomist should explain the procedure to the parent using a calm tone of voice and encourage the parent to hold or maintain other physical contact with the infant during the procedure, which is usually a heel stick. The minimum amount of blood necessary to conduct the test should be collected. While avoiding eye contact may, in some cases, indicate fear, anger, or dishonesty, for many Asian cultures it is a cultural norm, so the phlebotomist should follow the patient's cue and avoid the direct eye contact that is usually used to reassure the patient and promote communication. Patients may feel direct eye contact is rude. Other cultures that may avoid direct eye contact include Native Americans, and I don't know about this, but it says African Americans. I'm looking you dead in your face. Middle Eastern patients may avoid eye contact with the opposite gender. The organ that lies in the right upper quadrant of the abdomen, superior to the intestine, is the liver and gallbladder. The abdomen is typically divided into 4 quadrants with imaginary vertical and horizontal lines crossing at the umbilicus. Additional divisions into the right lower quadrant, which include the appendix and intestines. The left upper quadrant, which includes the stomach, spleen, and most of the pancreas, and the left lower quadrant, which includes intestines. Some organs, such as the kidneys, overlap quadrants. If blood must be drawn from a 3-year-old, the phlebotomist should explain the procedure to the child using language and terms that are age appropriate and taking time to speak with the child before touching him or her, because children of this age are often fearful of strangers and pain. When possible, the parent should assist, such as by utilizing a hug hold during the procedure or distracting the child. The phlebotomist should use a soothing tone of voice, praising the child during the venipuncture. Cotton balls should no longer be used to apply alcohol to the skin because small particles of lint may adhere to the skin and be injected with the venipuncture. Alcohol pads and or propion iodine wipes should be used for skin antisepsis. Other equipment needed for routine venipuncture include evacuation collection tubes, tourniquet, lint-free gauze, tape or stretch non-adhesive bandages, gloves, and syringes. If venipuncture is required for an elderly patient with obvious tremors of the upper extremities, the best solution is to ask the nurse to assist in stabilizing the arm. Equipment should be chosen carefully to avoid unnecessary trauma and prolonged venipuncture. Older adults, especially with small friable or friable veins, may bruise easily. Coban or other non-adhesive elastic bandages may be more appropriate than adhesive bandages because of the thinness of the skin in older adults. That's why we like Coban. Chemical hazards include preservatives used in the laboratory, as well as all other chemicals and acids that may result in burns or injury. Biological hazards include pathogenic agents such as viruses, bacteria, fungi, and parasites, which may be transmitted from blood specimens. Physical hazards include wet floors, which can cause falls, heavy objects, which may result in back injury, and inappropriately stored items, which may fall or block passage. Fire explosive hazards include oxygen and combustible material chemicals. Sharp hazards include needles, lancets, syringes, and broken glass. OSHA requires the use of needleless blood transfer devices as a means of decreasing the risk of needle stick injuries and infections as part of OSHA's bloodborne pathogen standards. Blood transfer devices should not be reused because of the increased risk involved in removing the needle and the risk of possibly contaminating the blood. Sharp use of blood draws should have sharp injury protection devices whenever possible. Needles without this protection should never be recapped, as this increases risk of needle sticks. An electrical fire is classified according to the type of fire, with an electrical fire classified as type C. Fire extinguishers are also classified according to the type of fire that they extinguish. So the ABC fire extinguisher, often commonly found in healthcare facilities, will extinguish type A fires, ordinary combustible materials, type B fires, flammable liquid, and type C electrical. The phlebotomist should always know the location of fire extinguishers throughout the lab and the facility, and should know how to utilize them in an emergency. Pull, aim, squeeze, and sweep. If a person is donating blood at a blood bank, the maximum volume of blood that the person can donate at one time is 500 mLs. Requirements include age 17 or older, 16 in some states with parent permission, weight 110 pounds or more. For donors 18 years and younger, weight 110 pounds or more, depends on height. People should bring a list of medications to ensure medications do not preclude donation of blood, such as Accutane, antibiotics, Flagyl, which, for example, methotrexate, anticoagulants, Coumadin, for example. In some cases, a specific period of time must elapse after collecting a drug before blood donation. So I see they're very careful about blood donation. According to the American Hospital Association, the Patient Care Partnership, patients do not have the right to expect cost-effective care. Their rights include high-quality care, which includes knowing names and qualifications of caregivers. Clean and safe environment includes freedom from errors, abuse, and neglect. Privacy protection, which includes providing notice of privacy practice and adherence to regulatory regulations regarding privacy, such as HIPAA, Health Information Portability and Accountability Act. Involvement in care includes discussion of medical conditions, treatment options, treatment planning, and decision making. Discharge planning, including identifying community resources and coordination of care. Assistance with billing claims, including filing claims. But they do not have the right to expect cost-effective care. Phlebotomists are most likely to develop sensitivity to latex because of wearing latex gloves, especially if the gloves are powder, because the protein in the latex adheres to the powder particles, increasing exposure. Exposure to other sources of latex, such as tourniquets, latex cap collection tubes, and medical equipment, like blood pressure cuffs and stethoscopes, may exacerbate sensitivity. Contact dermatitis with itching and redness is the most common symptom, but some people may develop severe anaphylaxis. Bandages are usually avoided in children younger than 2 years because they pose a choking hazard. Young children are usually very flexible and may remove a bandage, such as one applied to a heel stick and then place the bandage in the mouth. Instead of a bandage, the phlebotomist should maintain pressure on the puncture or venipuncture site, elevating the extremity for 2 to 3 minutes and checking to make sure that all bleeding has stopped. Immunologic. Testing of antibodies and antigens to detect the response to disease. Tests include HIV and hepatitis B viruses. Coagulation. Testing of blood clotting mechanisms of blood for both diagnostic purposes and to monitor anticoagulant therapy. So those are some tests they discuss. While wearing gloves and and using care not to allow the collection tube to come in contact with any item on the blood collection tray, the phlebotomist should carefully wipe all blood from the collection tube with a disinfectant and then seal the collection tube in a biohazard bag prior to placing it on the blood collection tray for transfer to the laboratory. The glove should be disposed of in a hazardous waste container. Now, the equipment that poses the greatest risk of transfer of bacteria in a hospital is bed rails, because they may be touched frequently by the patient and many healthcare providers over the course of a day, and they may not be routinely disinfected. The spores of Clostridium difficile, or C. diff, may survive for up to 5 months on inanimate surfaces, such as bed rails. Hepatitis B viruses can survive up to a week. Influenza virus can survive for 8 hours. The gastrointestinal tract is where most absorption of nutrients occurs, is in the small intestine. So, when it comes to the gastrointestinal tract, most absorption of nutrients occurs in the small intestines. Digestion begins in the mouth and continues in the stomach, which both stores food and mixes it with gastric secretion to further digest the food particles. The stomach absorbs some drugs and small amounts of water and electrolytes. While most absorption of nutrients occurs in the small intestines, the large intestines primarily absorbs water and electrolytes. Blood is supplied to the myocardium, heart muscle, by the coronary arteries, which arise from the aorta. So the heart is nourished before other organs. Did you know that? The left side of the heart is supplied by the left coronary artery, which branches into the left anterior descending artery and left circumflex artery, which supply blood to the left atrium, left ventricle, part of the right ventricle, and the septum. The right side of the heart is supplied by the right coronary artery, whose branches in turn supply the right atrium, right ventricle, and postural wall of the left ventricle. The skin is actually the largest organ in the body. The skin has specific functions, which include providing a barrier, maintaining body temperature, and allowing sensation. The largest internal organ is the liver, the brain, the next largest, and then the lungs and heart. The liver has both endocrine and exocrine functions because it produces hormones and excretes bile. While Mycobacterium tuberculosis is highly infectious, TB, better treatment and early diagnosis has markedly decreased incidence, so it is rarely a cause of non-succumbing infections unless the patient has been misdiagnosed. The common pathogenic agent associated with non-succumbal, which is healthcare acquired or healthcare associated infections, are Staphylococcus aureus, MRSA, methicillin-resistant Staphylococcus aureus, and C. diff, Clostridium difficile. Staphylococcus aureus and MRSA are often associated with wound and soft tissue infections, while C. diff, Clostridium difficile, results in infection of the GI system and severe diarrhea. You don't want that. Venues are small branching veins, and arteries are small branching arteries. Venues are small branching veins, and arterioles are small branching arteries, but they are not the three main vessels types. The three main vessel types are capillaries, veins, and arteries. The highest normal value for hemoglobin is usually found in a neonate, followed by the adult male, then the 6-year-old child, and the adult female. Neonates have high levels of hemoglobin, especially in the weeks after birth, because they retain some fetal hemoglobin, which has a higher affinity for oxygen than adult hemoglobin. The fetal hemoglobin is replaced by the adult hemoglobin usually within 6 months, resulting in a steady drop in the normal hemoglobin for the infant. PEP, post-exposure prophylaxis. I'm hanging in there, me and this flying eye. Post-exposure prophylaxis is available for exposure to HIV and HBV. However, no PEP is available for HCV, hepatitis C virus, although the CDC does provide a plan for management. If a phlebotomist has a needle stick injury, the person should immediately wash the area with soap and water and then notify a supervisor and seek medical care in an emergency department or from an appropriate healthcare provider. Post-exposure prophylaxis, PEP. Underfilling a green capped evacuated container tube may result in a low test result because this result is excess heparin and diluted effects. I'm going to repeat that. Underfilling a green cap evacuation collection tube may result in a low test result because this results in excess heparin and dilution effect. All right, the minimum accepted draw volume for the green cap collection tube is 50%. Overfilling, on the other hand, may result in insufficient heparin to prevent clotting, so clots may form. If this occurs, the blood sample must be discarded and a new sample obtained. The green cap tube may contain either lithium heparin or sodium heparin and is used for chemistry tests on plasma. Anytime a phlebotomist is unable to palpate or locate a vein for venipuncture, the person should call for assistance from someone with more experience and should not blindly attempt to do a venipuncture because this may cause unnecessary trauma. The phlebotomist may try applying a warm Morse compress for 5 minutes to distend the vein or try using a blood pressure cuff instead of a tourniquet. The needle insertion angle may need to be steeper than usual because of the depth of the vein. If the phlebotomist must don PPE to enter an airborne isolation room, the order in which PPE should be donned is 1 gown, 2 respirator, 3 face shield or goggles, and 4 gloves. The gown is put on first because the person must reach around to fasten it and may contact the hair or clothes in doing so. Then the respirator is applied and the face shield, which covers the respirator. Gloves are donned last because most contact with the patient is with the hands. During venipuncture, if the needle goes through the vein and a hematoma begins to rapidly develop, the next step is to remove the needle and tourniquet and apply pressure to prevent further loss of blood into the tissue. A hematoma may also form if the needle only partially penetrates the vessel wall, allowing blood to leak into the tissue. If blood flow stops and a small hematoma begins to form, the needle level may be up against the wall. The needle's bevel, that little hole, may be up against a vessel wall, so rotating it slowly may stop the leak and allow blood to flow into the collection tube. Venipuncture of the basilic vein, which lies on the ulnar side of the wrist, poses the greatest risk of accidental puncture of an artery because the vein lies in close proximity to the brachial artery. The medial cubital vein is relatively large and less likely to roll than some other veins, so it is usually the first choice for venipuncture, followed by the cephalic vein, which lies on the radial side of the wrist. The metacarpal veins are often easily visible, but should usually be avoided in older adults because of little supporting subcutaneous tissue. With the exception of the label, the AABB, American Association of Blood Banks, pink cap evacuation collection tube is the same as the lavender cap collection tube. The pink cap tube contains spray-dyed anticoagulant. The label for the pink cap tube meets the AABB requirements for patient identification and cross-match information. The pink cap tube is used for all blood bank testing. Before a blood specimen is collected from a newborn for routine screening, the infant should have nursed or been bottle fed for at least 24 hours. 48 is optimal, because many IEMs are related to problems with protein metabolism. The child needs to ingest protein in order for the test results to be accurate. Because some mothers and infants are discharged within 24 hours and the tubes may not be completely accurate, all mothers should be advised of the importance of a repeat screening after discharge. When entering a room to draw blood from an individual in contact precaution, the PPE that is generally required is gowns and gloves. The gown should be applied before the gloves and both removed at the door upon leaving the room. Additional PPE is needed only if the person entering the room is likely to encounter spray or splashes of body fluid, such as when a wound is being irrigated or a patient suctioned of oral secretions, or a lot of inpatients. The minimum accepted draw volume is 100% of the tube capacity for the blue capped evacuation collection tube, which is used for coagulation tests, and the yellow cap tube, which is used for blood cultures. For the blue cap tube, overfilling can result in coagulation of the specimen and underfilling prolongation of clotting times. For the yellow cap tube, overfilling may result in clotting and underfilling in too small a volume of blood necessary to recover pathogenic agents. Blood pressure cuffs require intermediate to low-level disinfection, usually through wiping with the liquid disinfectant. While disinfection should destroy most bacteria, viruses, and fungi, it does not destroy bacterial spores like C. diff.